Hello, my name is Annie Wallis, and I am going to be talking to you today about navigating the resources that are available within the Parkinson's community. I'm really excited to be here today, and hopefully you'll walk away feeling like you know where to turn for support. First, a little bit about me. I am originally from Tampa, Florida, which is where I live now, but I spent quite a bit of time up in Columbus, Ohio, where I got my master's in social work from The Ohio State University, and I began working for the Parkinson's Foundation in 2015. I started at what is now the Great Lakes chapter. At the time, we were the Central Ohio Parkinson Society, and then we were the National Parkinson Foundation Ohio. But like I said, I'm in Tampa, Florida now, and I serve as the Associate Director of Education for the Foundation. You're welcome to connect with me on LinkedIn. I'm always looking to be better connected with the Parkinson's community. And speaking of the Parkinson's community, it is an incredible group of people, but it can get a little confusing when you look at the international groups and the national groups and the local groups and the exercise groups and the groups who are focused on training clinicians to work with people with Parkinson's. I am proud to say that I have either personally or tangentially worked with every group on this screen, but it would be impossible for me to highlight every wonderful thing that every Parkinson's group does. So what I'm going to do today is to focus primarily on what we do at the Parkinson's Foundation, but I'm also going to spend a little bit of time highlighting some of what I think are the best resources from some of these other groups as well. And then I'll talk to you about some other things you should look for in your local community that aren't necessarily tied to Parkinson's, but that are relevant to everyone living with Parkinson's. So about the Parkinson's Foundation, we are the nation's leading community for people with Parkinson's disease and those who love them, as well as those who are working to end the disease. Our mission is to make life better for people with Parkinson's. We do this by improving care, advancing research towards a cure. And in everything we do, we build on the energy, experience, and passion of the global Parkinson's community. So that's why I've been able to work with so many incredible local, national, and international Parkinson's groups, because we put a high premium on collaboration. A little bit about what we do locally. If you're watching this, you're likely in our Great Lakes chapter, although perhaps there are some who joined in virtually who are outside of this scope. But just so that you know, the Great Lakes chapter of the Parkinson's Foundation is one of 17 chapters that covers the entire United States. And through the Great Lakes chapter, we provide education, resources, and programs throughout the states of Ohio, Michigan, and Western Pennsylvania. Our goal is to really be here to help, whether you are newly diagnosed with Parkinson's or if you've been managing it for quite some time, or if you're a care partner, family member, or friend of someone with Parkinson's. And if we take a closer look at what the Great Lakes chapter has done in the last 5 years, we've put a lot of effort into improving care for people with Parkinson's, including training over 2,000 health professionals and answering over 4,500 calls to our helpline. We've funded almost $1 million through 10 researchers, and we've trained 10 research advocates who will then go to work with scientists to make research more effective and more focused on the things that matter to people with Parkinson's. And we have distributed over 4,000 Aware and Care kits, and we've had so many people participate in our programs, whether they're educational programs or through our Walk for Moving Day. And if you're interested in getting more involved at the Great Lakes chapter, you can check out the website, parkinson.org/Great Lakes, where you can see wellness and exercise groups, support groups, educational and fundraising events. You can learn more about the community grant program or how to plug in as a volunteer. You can connect with us on Facebook, or you can connect directly with Lori, who manages Moving Day Dayton and Columbus, and she's really a great resource if you're anywhere in the Great Lakes to help make sure you're tied to the right people at the right time. Some other ways to get involved, we'd love for you to check out our PD Health at Home series. Since we're unable to do in-person programming right now, we are offering weekly online events designed for you. So we've got programs, Mindfulness Mondays, Wellness Wednesdays, and Fitness Fridays. So every Monday, Wednesday, and Friday, you can connect with us and have the opportunity to be part of the Parkinson's community from home. And I mentioned Moving Day. This program has raised over $27 million for Parkinson's and has brought more than 130,000 participants together. Again, this will be virtual this year, but if you're interested, we'd love for you to get involved. Now I'm going to talk to you about some of the educational resources that we offer at the foundation. First of which being our educational book series. So I've broken this up into 3 categories. For early Parkinson's, those of you who are on the newer end, maybe you're recently diagnosed within the last 5 years, or you feel like your symptoms are still pretty mild. I recommend the Frequently Asked Questions book and Living Your Best Life, which really walks you through how to cope with accepting the diagnosis, even if that diagnosis came a few years ago. And we actually also have a newly diagnosed kit that can be accessed and ordered online. When I think about things that are relevant to everyone with Parkinson's, I think about our Fitness Counts book. I think about Managing Parkinson's Mid-Stride, which is designed for folks who are more middle Parkinson's, when the medications may not be working quite as well, they take a little longer to kick in, or they don't last as long as they used to, and our medications book. And then the specialty topics are things that may or may not be relevant to you today, may not be relevant to you throughout your Parkinson's journey, but that we want you to have access to whenever you need them. So topics like cognition and mood and psychosis, and our Caring and Coping book designed for care partners. We encourage those of you with loved ones with Parkinson's to order a copy of that, or at least check it out online. It's great to have on hand, even if not everything in there is relevant today. And you can access all of these. You can download them, or you can order them online at parkinson.org/books. And in addition to the books, we also have fact sheets available, which is more like a bite-sized chunk of information on a more focused topic. So some of our top fact sheets include nutrition and Parkinson's, falls prevention, constipation and other GI problems, pain and anxiety. You can find all of these at parkinson.org/library, and a lot of them are also available in Spanish. If you prefer to listen or watch to learn rather than read, we also have some really great programs. Our expert briefing webinars are held 6 times a year. We have about 18,000 people register every year. And starting next month, we've got a series focused on young onset Parkinson's disease. And then in the winter and spring, we're focusing on symptom management and that ever troubling question of, is this my Parkinson's? Is it a medication side effect, or is this just a symptom of normal aging? So you can register for those at parkinson.org/EB for expert briefings. They're really fabulous. You can join in the day of, or you can watch them after the fact. Another great video program that I always want to mention to folks is our Care Partner Summit. So on the screen, you see the 4 panels that we held for our summit, which had to go suddenly virtual in May of this year, thanks to coronavirus, focused on cognitive changes, mental health, resources, and self-care. And you can access those videos as well as the 2016 and 2018 programs at parkinson.org/summit. We also have a whole section on caregiving and what we call Care Map, Managing Advanced Parkinson's, at parkinson.org/caregiving. And then we also have a caregiving section of PD Conversations, which is a community forum where people with Parkinson's, their loved ones, health professionals can all come together, ask and answer questions, and really create that community online. And then in addition to the video pieces, I always want to give a plug to our incredible podcast. Last year, we had over 90,000 downloads. You can listen to this through your smartphone, either through Apple Podcast or through the Google Play podcast episode. If you have an Amazon Alexa, you can use the Tune In feature, or you can use Spotify on any of these devices, or you can just go to parkinson.org/podcast to access them. These 3 episodes are my personal favorite. I thought the recent episode on managing anxiety really made a clear distinction between anxiety and depression in Parkinson's, which even though I've been focused on Parkinson's for 5 years, really made it even clearer for me. And so if that's something that's relevant to you, I cannot recommend it enough. And then the other two interview people with Parkinson's through some of our high-level volunteer programs, the Aware and Care Ambassador Program and the Research Advocate Program. So those are great. And honestly, the whole series is a great way to get little snippets of information while you're doing housework or while you're driving, just to plug in for 10 to 15 minutes of great content on Parkinson's. And I mentioned the Aware and Care Ambassador Program, which I'll talk about in a minute, but the Aware and Care initiative as a whole is really, really important. And I hope that it's something you all already know about. But if you don't, the hospital is a really challenging place for people with Parkinson's because 3 out of 4 don't get their medication on time. And if you've had Parkinson's for very long, you understand how critical the timing of medication is for Parkinson's. When this happens, 2 out of 3 will experience unnecessary complications. So we've created a set of materials designed to help you and your loved ones advocate for the best possible care when you are in the hospital, whether it's Parkinson's related or not. This can be useful if you end up in the hospital with appendicitis or after a car accident. We really want to make sure that every person with Parkinson's, even if you're on the early end of the disease, has this kit and knows how to use it. So you can learn more, you can download the information, or you can order a kit at parkinson.org/aware-in-care. And because we see how important this is, we've recently launched a new program, the Aware and Care Ambassador Program, where volunteers work directly with the Parkinson's Foundation to share the Aware and Care materials with their local communities and create connections in local hospitals to help change the culture and the policies around Parkinson's care. So our Aware and Care Ambassadors focus on educating the community, educating the clinicians who treat Parkinson's, and educating hospital staff. So when we finish our second round of trainings next month, we'll have over 100 Aware and Care Ambassadors representing 38 states and Puerto Rico. And these are made up of people with Parkinson's, current and former care partners, support group leaders, nurses, physical therapists, speech language pathologists, social workers, medical doctors, fitness instructors, and first responders or EMTs. And here in the Great Lakes chapter, we've got a few down in the Cincinnati area. We're training some new ambassadors in Dayton and in Northeast Ohio. And we've got representation in Michigan and in Western Pennsylvania. So this is a resource for you and your community. And if it's something you're interested in, you can learn more by reaching out to me or by going again to parkinson.org/aware-in-care. The other really, really key resource, if you walk away with nothing else, remember that our toll-free helpline staffed by Parkinson's specialists is available to you. They answer almost 20,000 calls each year. And all you have to do is call 1-800-4PD-INFO. They're available Monday through Friday from 9 a.m. to 8 p.m. Eastern, or you can even email in your question to helpline@parkinson.org. If you remember that resources exist, but you don't remember where to go, you can reach out to them for information about any of the things I've talked about so far. And the really cool thing with PD Conversations, which I mentioned a little bit earlier, is that the Parkinson's specialists who manage the helpline also visit PD Conversations and will jump in if there are important resources that haven't been mentioned. If there are topics that aren't being addressed, they're a part of that conversation as well. So when you look beyond the Parkinson's Foundation, these are 4 things that I want you to know about. I want you to know about the Michael J. Fox Foundation Fox Trial Finder. This is the easiest way to find what clinical trials are available near you. From the Davis Phinney Foundation, they just recently hosted an incredible webinar talking about health disparities in Parkinson's. I couldn't find a good short link, so my best bet for that, if you're interested in that, is to visit YouTube and search Davis Phinney Foundation and the health disparities, and you can access it there. The PMD Alliance has an incredible empowerment tool which allows you to think through all of the different things, all the different symptoms of Parkinson's, so that you can be prepared ahead of a doctor's visit to say, these are the things I want to talk about. I don't want to forget any of this. And then the World Parkinson Congress is this incredible international event that brings together everyone in the Parkinson's space. You know, the organizations like the Parkinson's Foundation, people in the Parkinson's community, clinicians, and researchers. And if you're not familiar with that, I encourage you to just take a look. I also wanted to just mention for you all that there are incredible places to get care in the Great Lakes chapter. Of course, we have our Center of Excellence at the Cleveland Clinic, who's hosting this event today. They're our only Center of Excellence in the chapter, but there are a lot of other great movement disorder centers throughout the region. And you can search by zip code to find movement disorder specialists or neurologists near you at parkinson.org/search. I also wanted to flag for you the social workers that I know of in the Ohio area. Social workers can really help you get connected with what's happening in your community. They can help make sure you're thinking ahead, not just in crisis mode. Social workers focus on person in environment. So thinking about what's most relevant to you, what's most challenging to you, and how to address that. So at Cleveland Clinic, we've got Leah, who shared that she's newer to Parkinson's disease, but so far she's been really fortunate to see the strength and resilience of this community. Down in Columbus, we've got Erica, who's at the Movement Disorder Center at Ohio State. And Ohio Health also shares a neuroscience social worker between the Movement Disorders Department, Stroke, and Geriatrics, although I wasn't able to get the name or the photo to include in my slides. But if you receive care at Ohio Health, ask about that neuroscience social worker. Down in Cincinnati, we've got Becca, who shared that she believes in the strength of the Parkinson's community and the important benefits of connecting individuals with their local PD community for support, education, and resources. And then up in Toledo, we've got Kristen, who has worked with the Parkinson's community for 21 years through the University of Toledo. She facilitates a caregiver group and is very connected with all of the groups in Northwest Ohio. And she said she loves to share the many things she's learned over the years from caregivers and people with Parkinson's with others. So there are definitely other social workers who can help you in your community, but these are the ones who are associated with some of the big movement disorder centers in Ohio. There are certainly great social workers in Michigan and in Western Pennsylvania, if that's where you're residing. And if I didn't cover one near you, this is another thing you can reach out to the Parkinson's Foundation Helpline to learn more about. And then looking beyond the Parkinson's groups, I want to make sure you all know about the Area Agencies on Aging system. This is a program that exists pretty much everywhere in the United States. And these agencies are responsible for attending to the needs of older adults as advocates, planners, and funders. They provide education, information, and referral services. So Michigan has 16 area agencies on aging, covering all of their 83 counties. Ohio has 12 that represent their 88 counties. And Pennsylvania, this was interesting, I didn't know this until I looked into it, has one area agency on aging per county. So I've got the websites up there if you want to look into this. For those of you who are under 60, they may or may not be all that helpful for you right now. If you have a documented disability, if you've been approved for disability insurance, often the disability resource centers are housed within the area agencies on aging. So if that's the case, they may have some resources for you. But if you're under 60 and that's not the case, this is something to just sort of tuck away as a resource for later in your life. And then finally, 211. I am a huge proponent of all people in every community understanding what 211 offers. I'm a little biased because I used to answer the 211 crisis calls, but it's available 24/7, 365 days a year. And it's the most comprehensive source of locally curated social services information in the United States and most of Canada. During COVID-19, 211 centers are working closely with state and local health officials to make sure that you can get up-to-date information about the virus and update. And additionally, 211 can provide help with so many different things that may or may not be connected to your Parkinson's, but are likely really relevant to you, whether that's supplemental food programs or housing options or utility assistance, emergency information for disaster relief, employment and education opportunities, services for veterans, reentry for ex-offenders, support groups, or even a safe and confidential path out of domestic abuse. Think of this as the go-to place to find out what's available in your local community. And all you have to do is dial 211, similar to how you would dial 911 in an emergency. So in summary, I hope that you guys are going to walk away from this recognizing that you are not alone. In addition to all of the incredible people with Parkinson's who live around you, and there are plenty of them, even if you haven't plugged into the Parkinson's community near you. I hope that you will look to the Parkinson's Foundation for local programming, for educational resources, and for support and community, whether in person or online. And I hope that you'll feel comfortable looking to your local community for expert Parkinson's care, to find social workers and other helping professionals, and to access local resources through 211 and the area agencies on aging. There's so much available for you, so please don't hesitate to reach out to find ways that you can get the help and support and information that you need to manage Parkinson's. And thank you for your time today. I hope that this is helpful as you learn to live well with Parkinson's. Thank you.